A lot of people around the valley could be especially vulnerable to this extreme heat and not even realize it.
That's because some commonly prescribed medications can mask the symptoms of a heat illness. Our Steve Wolford joining us now from the live desk with an important warning for mental health professionals.
Yeah, that's right. We're talking about some drugs called antipsychotics and mood stabilizers, widely prescribed. They're used to treat things like bipolar disorder. If you're taking them, the National Institutes of Health says your risk of dying from the extreme heat can double. That's because these drugs affect areas of the brain that turn on your body's cooling mechanisms, like sweating. They can also impact a part of your brain called the hypothalamus, which is part of your body's thermostat. Most people taking these kinds of meds are used to the Las Vegas heat. They know how to stay hydrated, things like that. But local psychiatrist Dr. Timothy Jeider says that there are two segments of our population who are especially vulnerable. The homeless, of course, because they might not have access to a place to cool down, and some of our visitors.
The tourists actually are probably going to be people who might have bigger issues because they aren't necessarily used to our environment, our climate, and our dry heat. And so those folks might find themselves surprised because, one, they're probably also drinking alcohol, which they shouldn't be doing on these medicines. So they're getting dehydrated from that. They're in a dry, hot climate that they're not used to, hanging out by a pool, which I guess if you're in the water, that can be helpful. But again, your overall hydration status matters, and if you're not cooling down, you can still run into these issues.
Dr. Jeider says another drug that can cause serious problems in the heat is lithium, which is prescribed for epilepsy and bipolar. If you're on one of those meds, stay hydrated and stay cool. And if you're with someone on antipsychotics or mood stabilizers, just keep a close eye on them in this heat. Make sure they get cooled off if they start showing any symptoms like confusion, fatigue, or a headache. That's it from the live desk. Back to you.
Good warning to point out, especially with this heat sticking around for a while. Steve, thanks.
Getting a little break from the excessive heat right now, but soak it up because it won't be long before that heat is back. And of course, that raises the risk of heat-related illness.
And that is especially true for people taking certain prescription medications to maintain their mental health. Our Steve Wolford joins us from the live desk with some good advice from a local psychiatrist.
Yeah, and it's something we don't talk about very much, but we need to get it out there. We're talking about commonly prescribed drugs in a category called antipsychotics and mood stabilizers. They're prescribed for conditions like schizophrenia or bipolar disorder. But the National Institutes of Health says your risk of dying from these meds in extreme heat can double. If you're on a mood stabilizer or antipsychotic, symptoms that you're overheating can include confusion, fatigue, or headache. The problem is these meds can actually hinder your brain's ability to tell your body that it needs to cool off.
They impact our dopamine in our brain, which is responsible in part for how we regulate our body temperature. They also have anticholinergic effects, which is the fancy way of saying it impacts your body's ability to generate sweat, which is actually a very important part for regulating our temperature. Final thing that makes all of this even worse is it impacts our hypothalamus, which is actually part of the body's thermostat. And so our bodies don't pick up on the fact that this is actually occurring.
Dr. Timothy Jeider says, in other words, you can be sitting in the sun getting hotter and hotter, and your body doesn't even realize it's having a problem. He says another drug that can cause serious problems in the heat is lithium, which is prescribed for epilepsy and bipolar disorder. That's it from the live desk. Back to you.
One of the many things to consider, as you said, Steve, that heat is going to be back soon. Thank you.